All right, Richard, we just finished this exam, checking you out. After doing this exam, I believe that there's a pretty good chance that you might have an ACL injury. I'm sure you've heard of that before. If not, I can give you a little bit of background on it. The ACL is the ligament basically in the middle of your knee that provides a lot of stability to it. Um, and I think that that ligament is torn, and that might be what's causing all of the instability that you're feeling and your leg giving way. Um, I also think that you might have sprained your MCL, which is another ligament in your knee on the inside. That's why you feel a little bit of pain when I was touching in that area. Um, so that's what I think might be going on. Um, and I know if you're familiar with ACL injuries and you've heard that before, that you might be a little scared. Um, there's no reason to be. A lot of times, whether it's treated with or without surgery, there's a lot of good outcomes. A lot of times in older individuals, when this happens, they'll go without surgery completely, and they will just live the rest of their life without their ACL because they don't need to be as active as you probably need to be. So what I would suggest for you would be to go the surgery route because you're pretty young, and you've got a lot of energy left in you, and I'm sure you want to get back to skiing. Um, and I know that one of your other goals is to be able to dance with your girlfriend in a couple months, so that's important too. Um, but as far as the timeline for everything and what I'd like to do moving forward, um, I would like to send you to get an MRI just to make sure that that's actually what's going on, to make sure that the ACL is torn. It feels like it is, and it looks like it is with all of the examination findings that we just did and we just found. But I just want to check to be sure. So we'll do that. And on the good chance that it is torn or ruptured, um, you're probably looking at surgery if you wanted to go that route and be able to get back to the things that you wanted to do. But along with that, there is a long rehab period after the surgery. It's a long road and it's not the easiest one. Um, but I just want you to be aware that if you do choose to go for surgery, that is a road that hopefully you'll choose to go down, and hopefully come back and see us, and we get you back to health, back to skiing. In terms of what you might be able to look forward to in terms of your goals, um, I do think it's reasonable to believe that we could get you good enough in 4 months or so to have you dancing with your girlfriend. Um, but I would say at least for the rest of this season, I don't um, think it would be plausible to have you return to skiing and slalom for the rest of this season. Um, I think come next season, you'll be able to come back better than ever, but I think this season we'll have to put off for this season. So, do you have any questions that you'd like to ask me? If you don't have any questions, then I'd like to write you a referral to go get an MRI and make sure that that's the ACL is what we're dealing with. And then hopefully we can get some, if that is the case, we can get surgery scheduled for you pretty soon. And then a couple weeks after that, you can start some rehab here with us, and we'll get you back to health, get you back to doing what you love, and getting you back skiing for next season better than ever. All right.